I'm here with Dr. Michael Lange from the Lange Eye Institute.
Lange Eye Care and Associates and Lange Eye Institute.
And we're going to be talking a little bit about eye health, and we're also going to be talking about astaxanthin, the powerful carotenoid for eye health. Let's start by just you telling us your background and what you do down here in Florida.
Well, I'm a board-certified optometric physician. I'm also a certified nutritional specialist. I actually moved to Ocala, Florida, March 15th of 1993. Can't forget that date. And set up my first practice, Lange Eye Care and Associates. I think I was blessed to be in the right place at the right time. We now have 9 locations. We have 3 LASIK centers. Also, not only a board-certified optometric physician, but I became a certified nutritional specialist because one of the reasons we've grown so fast is we use a nutritional way to complement our examinations. So we really try to help patients not only through traditional medical therapy, surgical intervention, but to use nutrition to the fullest extent. At the Lange Eye Institute in the Villages, which is just a hop, skip, and a jump from here, we actually have an intracellular blood lab in there where we utilize not only serum and plasma blood tests, but also intracellular blood tests where we're looking at the lymphocytes. And this is kind of like the hemoglobin A1C of nutritional testing. And it allows us to determine if a patient has a nutritional deficiency that may be a risk factor for an ocular disease, like glaucoma, macular degeneration, cataracts. So ultimately we use this to help our patients a lot further along the process, utilizing nutrition and utilizing specific supplements like maybe astaxanthin and some other nutrients that we may talk about.
Well, we've been working together now for a little while, and we're working on making a new eye health formula based on some potent carotenoids, and also we're talking about incorporating krill oil into your product. Can you talk a little bit about that?
Absolutely. The 2 things you bring up, the krill and the astaxanthin, are typical nutrients that you don't find in an over-the-counter nutrient preparation or any type of vitamin formula out there right now because it's relatively new to the supplement industry. The good thing about krill is a good source of omega-3. Omega-3 is huge right now. Right? Omega-3 you can get from plant sources, you can get from animal sources, you get from fish oil, you can get from flaxseed oil, you can get from krill oil. The good thing about utilizing krill oil is it has phospholipids naturally occurring in the oil itself. This is going to help bioavailability and absorption. Also, you don't have to take a large pill the way these fish oils, these are mega capsules. And you don't get the burp back with that you do get with traditional types of fish oil pills. So it's another mainstream way, I think, to incorporate omega-3s into the diet. The good thing about omega-3s now, there's studies out there that indicate if you take omega-3 in conjunction with a carotenoid like lutein, zeaxanthin, maybe even astaxanthin, it actually improves the absorption of this. So there's a reason to incorporate the krill oil with these carotenoids. Now, when we talk about carotenoids, this is an exciting area that I really am getting a lot more excited every day about, astaxanthin. So we know that carotenoids, the correct carotenoids, xanthophylls, okay, are good for ocular health, okay? Lutein and zeaxanthin has been shown in a multitude of studies to replenish the pigment density in the macula, help block the unwanted harmful rays from the sun, especially the blue light, the high-intensity visible spectrum of the sun. But now astaxanthin has emerged, and astaxanthin is a supercarotenoid that is what gives salmon its orange or reddish color. Okay, it is in krill, it's in shrimp, it's in a few other species out there, lobster. I think even a little bit in the rainbow trout. But realistically, how many people, kids, adults, grandparents, are eating these foods daily?
Not that many.
That's right. Now you eat spinach, you eat kale, you eat collard greens, you eat peppers, orange bell peppers, so you're getting the lutein, you're getting zeaxanthin, you eat eggs that have all this in it. That's in your daily diet. It should be in your daily diet. But astaxanthin, I think, is something that is mostly deficient in the American diet, maybe in all industrialized countries. So astaxanthin is something that is going to become, I think, huge. It starts small, but it grows. And the thing I really like about astaxanthin, being a board-certified optometric physician as well as a nutritional specialist, is the anti-inflammatory properties. Okay.
Oh yeah.
We know many diseases in the body and the eye are related to inflammation. Now, there are studies out there that have shown that astaxanthin can actually reduce C-reactive protein. C-reactive protein is one of the biggest risk factors for macular degeneration.
And that's usually at doses of about 2 to 4 milligrams a day?
Right. I've seen studies from 2 to 4 up to 8 milligrams. I've seen some studies using higher dosages where they're actually helping protect the DNA and actually boost the immune system. But for this anti-inflammatory component, what excites me, being an optometric physician, is the potential for keratoconjunctivitis sicca. Try to say that 3 times real fast. That's dry eye syndrome, all right? So that's related to inflammation of the cornea. Uveitis, inflammation inside the eye, all right? An iritis, similar to uveitis, and then different types of retinal problems. So if we can lower C-reactive protein naturally without a drug, if we can actually lower the prostaglandin PGE2, this is series 2 prostaglandins. I do a lot of research in this area. We may help with these inflammatory diseases. Astaxanthin have been shown to actually lower tumor necrosis factor as well as nitrous oxide synthase. So these are all inflammatory markers that if we can simply put more astaxanthin into the body, we may help. Not only is that going to help the eye, but it's going to help the entire body.
Well, C-reactive protein is also associated with propensity towards heart attack and that sort of thing, which is caused by inflammatory markers in the body. I think I read that in 1 8-ounce serving of salmon, you get about 3 milligrams of astaxanthin, so that's 1 day's worth, basically.
And that's wild salmon, and that's actually relatively expensive. If you look at it, it's not cheap.
Right. So the way to really get your astaxanthin is through supplementation.
I think that's absolutely the future. I think we'll see a lot more supplement companies utilizing the benefits of astaxanthin. If they're not already, they're going to be starting to utilize it, especially as more and more studies come out. And I think that's an area that fascinates me as well, is maybe initiating some of these studies and looking at it clinically, how it's absorbing and how it's absorbing into the retina. You know, is it doing a similar effect as lutein and zeaxanthin? Does it actually replenish the macular pigment density? We know it crosses the blood-brain barrier, so I would assume it probably does that, if not better. Also, astaxanthin is a super antioxidant. All right, we're talking much more potent than vitamin E or beta-carotene or vitamin C. It's just much more potent as an antioxidant, so we're going to combat against free radical damage in the body and in the eye. The ORAC value of astaxanthin is tremendous, so that stands for oxygen radical absorbency capacity. So once again, if we're taking foods that have high ORAC values, we're only doing a good thing for the body. We're combating against free radical damage, which is aging.
Now, you've been through our facility here, our ultra-high pressure, organic certified extraction facility. What do you think of our facility, and does it meet your standards for quality?
I am very impressed. State-of-the-art facility here. And as you know, I'm in the supplement business as well at manufacturing supplements. And that's one of my goals, was trying to find somebody that was the best on the block, all right? We want the best products going into our bodies, into our patients' bodies. And you guys have created a world-class facility. Like you said, all organically raised products. There's nothing like it in the world that I know of.
And you have a line of vitamins that you provide to your patients, and what are they called?
Fortify, right? Fortify. I started the Fortify company, about 7 years ago. We've got a Fortify 1 a day, Fortify Complete Plus, Fortify Complete Macular Defense, and a new product called Fortify Dry Eye Extreme. And this new product is really pretty interesting because we're using the benefits of astaxanthin. We're also going to be using the benefits of astaxanthin in the entire line of Fortify vitamins. So as we had talked about earlier, astaxanthin is a nutrient that has some amazing nutritional benefits for the eye and the entire body.
So it works against inflammation in the body. It also acts as a UV filter. We talked a little bit about that before. It also intercalates in membranes that contain DHA to protect them against oxidation, ultraviolet light damage, free radical damage. And we're working together on a new formula that incorporates astaxanthin, lutein, zeaxanthin, krill oil, and vitamin D. And we're about to put together this formulation with your advice at the proper nutritional levels. And we're going to launch this product in the near future as one of your products.
Right, and this is something that will be available for people in the early stages of their life, not just when you develop disease, because what we want to do is practice prevention. So we want to develop a formula that a patient can take that's cost effective. Number one, it's not going to break their piggy bank.
Right.
Number two, it's based on legitimate science. All right. Number three, it actually absorbs, and we have true studies that will be able to prove that it's absorbing into the cell and it actually works. So this product that you mentioned, astaxanthin, lutein, zeaxanthin, vitamin D, krill oil, all of these things are going to be beneficial for ocular health, but also for the entire body. Now, you didn't mention anything like vitamin C and D and E and the minerals. So patients will take this in conjunction possibly with a whole body supplement, all right? Or in conjunction with something their doctors have them on. It'll just work in harmony.
Now, before you talked about whenever you go out in the sunlight, when you go golfing, when you're driving your car, you should be wearing a good pair of sunglasses. But there's other situations where your eye may be strained or stressed, like looking at a computer screen all day.
Absolutely. Computer vision syndrome is huge these days. Everybody's on a computer 5, 6, 7, 8, 10, 12 hours a day. Some very interesting studies out there regarding increased circulation to the ciliary muscle, the ciliary body, the muscle responsible for accommodation, related to astaxanthin. Right. And I've seen studies as low as 2 and as high as 8 milligrams of astaxanthin actually improving the ability, the accommodative ability, and reducing asthenopia and eye strain and eye fatigue. So absolutely, astaxanthin, I think, has been proven with numerous studies now to help with eye fatigue. Absolutely, astaxanthin for accommodative insufficiency, accommodative and focusing problems, eye fatigue related to prolonged use of the computer or prolonged reading. Also, prolonged driving. So professional drivers may want to be able to take astaxanthin also because a lot of accommodative stress, believe it or not, related to looking in the distance, the speedometer, the map, texting, which you shouldn't be doing while you're driving. Like I said, let's recap on some of the benefits of astaxanthin. A very powerful antioxidant, a super antioxidant, more powerful than the typical vitamins that are on the market. A very powerful anti-inflammatory, all right? Helps decrease C-reactive protein, tumor necrosis factor, nitric oxide synthase, and the one I like is prostaglandin PGE2, series 2 prostaglandins. I've seen some recent studies talking about astaxanthin and boosting the immune system and also helping protect DNA. Also studies about improving circulation to the eye. So it may be something that will be a very good approach for future use for people that have developed ischemia of the eye. This means oxygen starvation to the eye due to an occlusive artery disease and central artery occlusion, vein occlusion, branch vein occlusion, and optic neuropathy. Maybe, just maybe, astaxanthin will be utilized to help these patients as well.
We've looked at the literature together. We've looked at the studies, the Karma study, for instance, on astaxanthin and eye health. And it looks like a level of 2 to 4 milligrams a day of astaxanthin is a good base amount to work with. Is that your understanding also?
Right, I think absolutely. I have seen some studies out of Japan where they utilize 6 milligrams for the accommodative component and for fatigue. So I think certainly between 2 and 6 milligrams, what is the magic number? What's the magic bullet? Remember, the majority of our population is getting none. Okay, once in a blue moon they go out to the restaurant and they order salmon, and it's farm-raised salmon. Okay, so we're deficient in astaxanthin to begin with. What I'm going to do is try to talk with the company that we do the intracellular blood work on and see if they can start looking at the lymphocytes now for astaxanthin, because we look for EPA and DHA, we look for all the vitamins and minerals and even lutein. So I want to see if they can actually check for astaxanthin, and then that can be a routine panel that we do on our patients when they come into the Lange Institute, and I mark my words, we're going to see dramatic deficiencies in astaxanthin.